Well, next week is National Infertility Awareness Week. So we wanted to highlight a new fertility clinic here in the upstate that is getting ready for a grand opening. We've got Dr. Creighton Likes here to talk about it, give us some updates. How's everything going?
It's going great, Megan. I appreciate you having me.
We'd love to have you. How long have you been doing this?
So I've been back in Greenville after my subspecialty training for almost 14 years. So I've been doing fertility treatments for almost 14 years now.
Okay, next week is National Infertility Awareness. Like, what is it? It's like 1 in 6 people worldwide are affected?
Right, so the prevalence is kind of alarming. The WHO will say 1 in 8 to 1 in 6 couples will have struggles with infertility. And so Resolve.org, a national organization, started National Infertility Awareness Week a few years back. And correct, next week is the kickoff of it. And so it's to raise awareness and get the word out.
Yeah, well, what are some things people should be aware of? Because it's everybody's journey is different. Some people think, oh, the first time I try, look, I'm going to be pregnant, and 9 months later, I'm going to have a little baby.
Right, and that's a very pervasive theme. So
yes.
If you read the textbooks, if you're under 35 and you've been trying for 12 months and it hasn't happened, then it's time to see a fertility specialist. If you're over or 35 or over and you've tried for 6 months, then it's time to see the specialist to get an evaluation. The reason for that is age is the #1 predictor of fertility.
Yeah.
And so that's where those numbers come from. Now, I will be honest, a lot of patients, and rightfully so, don't necessarily want to wait that allotted time. And so it's perfectly fine to see a fertility specialist prior to those dates.
Because what are some of the things that everybody is different, but like the first someone comes in, it's like, all right, it's been a year, nothing's happened, or like, am I doing something wrong? Am I too old?
So what we will do is we'll take a full history, we'll ask a lot of questions, but then, we broaden our scope of what we look at. We look at both the male and female side, because we have to remember about 30 to 50% of the time it can be a male factor. About a third of the time it can be a combination of factors. So we'll do evaluations from the male side and female side, and we'll do ultrasounds, lab work, and kind of get an idea, kind of a snapshot of where they stand, and then move treatment from there.
I love it. Okay, well, tell us about, your new big news and where you're headed.
Right, so I was very excited last year. CCRM, Colorado Center for Reproductive Medicine, reached out to me, and they want to put a center in the Carolinas, and Greenville is going to be the first one. So they reached out to me and said, would you like to spearhead this? And of course, I was ecstatic because everybody in our field knows that CCRM is a very, very well-known nationwide fertility practice, and they have clinics all over the country and even in Canada. And so they have an excellent reputation. So when that was approached to me, I couldn't say no, and so I'm ecstatic. And what I also think it says is Greenville is on the map, so to speak. We all know that we're all making these top 10 lists, but to have it, because they're in all these metropolitan areas across the country, and to have Greenville the first one in the Carolinas is huge, I think.
So what is that going to mean to patients or future patients or people? I mean, because, sometimes people were making trips to Colorado to go, and that was like a legit option.
Absolutely. It's going to give some of our patients here locally, but also in the surrounding areas, the chance to have a state-of-the-art fertility center, and again, that well-known brand, so to speak. The biggest thing from a fertility center I think people need to look at is twofold. One is obviously the physician, the faculty, and that's where I come in, or the staff, and that's where I come in. And then the IVF lab. And that's what CCRM is known for. They're known for their expertise in the IVF lab and high success rates.
Okay, we're going to have a little kind of meet and greet coming up soon. Tell us about that. A little open house.
That's right. So National Infertility Awareness Week, as we said, starts next week, next Tuesday. So a week from tomorrow, the folks at Harrington's downtown have been gracious enough to host a happy hour meet and greet. I'll be there with some CCRM swag and answering any questions, talking about National Infertility Awareness Week and getting the word out. Y'all,
this is a great time too to see are there little things you could be doing before you need to go to a full? I mean, it's like, you get one-on-one with the doc to get so take advantage of this too.
Absolutely.
And then can we say where this clinic is going to be? Are those details ready?
The address will hopefully be released as of tomorrow.
Ooh,
literally, the legality of the lease is going on now, but I can tell folks that it's going to be in the area of the Patewood Verde location.
Okay, all right, so nice and convenient. Well, this is like a big this is so cool, but I'm sure a little overwhelming too. Okay.
It's great though. It's great. And one thing I will tell folks is be proactive, advocate for yourself, and like you were saying, talk to physicians. Come talk to me next Tuesday and ask those questions, because it's not going to be wrong to start early.
Okay, I love it. Well, good luck, Dr. Likes. Once everything gets open, we'll have to have you back to be like, we're open, come see us.
Absolutely, I appreciate it.
All the jazz. All his information's right there on your screen if you need it.